Welcome to the channel, the Code Purple Project, where we shine a light on mental health, one story at a time. In today's video, we're diving deep into a question many people silently ask themselves. Is anxiety a normal part of life, or is it a sign of something more serious? Whether you're trying to understand your own experiences or support someone close to you, you're in the right place. Let's begin. Anxiety is something we all feel from time to time, before a big presentation, during moments of uncertainty, or in the face of danger. But when those feelings become constant, overwhelming, or start interfering with everyday life, it raises a crucial question. Where's the line between normal worry and a diagnosable mental health disorder? We'll uncover the truth about anxiety, what it really is, when it becomes a problem, and why understanding that distinction is so important for your mental well-being. 10. Everyone experiences anxiety, and that's completely normal. Let's start with the basics. Anxiety, at its core, is a survival mechanism. It's your brain's natural alarm system designed to alert you to danger. When you feel your heart race before a job interview, get butterflies before public speaking, or worry about a loved one, that's anxiety doing its job. In these moments, your body is preparing you to face a challenge or respond to a threat. This is perfectly normal and even helpful in small doses. 9. Anxiety exists on a spectrum. One of the biggest misconceptions about anxiety is that it's either something you have or don't have. In reality, anxiety exists on a wide spectrum. At one end, you might feel mild nerves before an exam. At the other end, you might experience full-blown panic attacks that disrupt your ability to function. Most people fall somewhere in between. You can experience moments of anxiety without it being a problem, but when those moments become constant or extreme, that's when it may cross into the territory of a mental health disorder. 8. Anxiety becomes a problem when it interferes with daily life. The difference between normal anxiety and a clinical anxiety disorder lies in its duration, intensity, and impact on your life. Occasional anxiety is completely normal. But when anxiety becomes chronic, meaning it lasts for months and starts interfering with your ability to work, maintain relationships, sleep, or enjoy life, that's when it's no longer just nerves. At this point, it may be time to speak to a mental health professional. 7. Physical symptoms can make it feel even worse. One of the reasons anxiety can feel so overwhelming is because it doesn't just affect your thoughts, it impacts your body. People with anxiety often experience physical symptoms like a racing heart, chest tightness, muscle tension, dizziness, stomach issues, or even shortness of breath. For some, the physical symptoms are so intense they mistake them for serious health issues, like a heart attack. This is one reason anxiety is often misunderstood and misdiagnosed. 6. Chronic stress can turn into an anxiety disorder. Stress and anxiety are often linked, and chronic stress is one of the major contributors to developing an anxiety disorder. When you're constantly exposed to stress, whether it's from work, relationships, financial worries, or trauma, your nervous system stays in a prolonged state of fight or flight. Over time, this can wear down your ability to cope and lead to lasting changes in how your brain processes fear and worry. What starts as occasional stress can evolve into persistent anxiety, where the feelings continue even after the stressor is gone. That's why managing stress is a critical part of preventing and addressing anxiety disorders. 5. Environmental and genetic factors play a big role. Why do some people develop anxiety disorders while others in similar situations do not? The answer often lies in a combination of genetics and environment. If you have a family history of anxiety, you're more likely to develop it yourself. But environment plays a huge role too. Trauma, abuse, neglect, or even major life changes can all trigger anxiety. Brain chemistry and personality traits, like being more sensitive to stress or prone to perfectionism, can also contribute. 4. Avoiding triggers makes anxiety worse over time. It's human nature to avoid what makes us uncomfortable. But when it comes to anxiety, avoidance can actually make things worse. If you start avoiding driving, going out in public, or speaking up in meetings because of anxiety, it can create a cycle that reinforces the fear. Avoidance gives anxiety more power over your life. Over time, your world can shrink as you try to dodge anything that might trigger discomfort. One of the most effective ways to treat anxiety is through gradual exposure, facing your fears in small, controlled steps to retrain your brain and reduce the fear response. 3. Anxiety disorders are among the most treatable mental health conditions. Despite how overwhelming anxiety can feel, it's one of the most treatable mental health conditions. Cognitive behavioral therapy, CBT, is the gold standard treatment and has been proven effective in countless studies. CBT helps people recognize and change negative thought patterns and behaviors that fuel anxiety. Exposure therapy, mindfulness, and acceptance-based approaches are also commonly used. In more severe cases, medications like SSRIs can be very helpful. Lifestyle changes, like regular exercise, proper sleep, reducing caffeine and alcohol, and practicing relaxation techniques can also support recovery. The key is consistency and finding what works for you. 2. Getting help is a sign of strength, not weakness. Too many people suffer in silence because they believe asking for help means they've failed. But the truth is, seeking help is a powerful act of courage. It takes strength to admit that something isn't right and to take steps to improve your mental health. Seeing a therapist, talking to a doctor, or even opening up to a trusted friend can be life-changing. The more we talk openly about anxiety, the less stigma there will be, and the easier it becomes for people to get the support they need. No one should have to struggle alone, especially when help is available. 1. So, is anxiety normal or a disorder? It depends on one key factor. And now, the ultimate truth. Anxiety is both normal and, in some cases, a disorder. What determines the difference is whether the anxiety controls you or whether you control it. When anxiety is brief, appropriate to the situation, and doesn't prevent you from living your life, it's normal and healthy. But when anxiety becomes chronic, excessive, and starts limiting your ability to function, it becomes a disorder. The key isn't to eliminate anxiety entirely, but to manage it in a way that empowers you rather than paralyzes you. And the good news is, with the right tools and support, that's absolutely possible. If this video helped you better understand the truth about anxiety, don't forget to like, share your thoughts or personal experiences in the comments. Send it to someone who might need clarity, and subscribe to the Code Purple Project for more eye-opening content. Together, we raise awareness. Together, we break the stigma.